So this is a generic overview of some frequently asked questions regarding joint replacement surgeries, both the anatomic total shoulder as well as the reverse shoulder replacement. Prior to your surgery, we will be meeting with you, and at that visit is when we will let you know the exact location and time of your arrival prior to the surgery. Now, the night before the surgery, there is no food after midnight. You may have water up to 2 hours prior to your arrival time to the hospital or outpatient surgical center. Please, no food. You must stop anything that thins your blood 5 to 7 days prior to the surgery. This includes any blood thinners, aspirin, Advil, Aleve, multivitamins, fish oil, CoQ10. If you are not sure, either call and ask or stop it. Your primary care doctor should go over any of your prescribed medications with you. However, it is recommended that 1 day prior to the surgery, you stop certain hypertensive medications such as ARBs or ACEIs. These are medications that the generic name ends in either Prils, P-R-I-L, or Sartans, S-A-R-T-A-N-S. In terms of the day of surgery, you will see Dr. Levy the morning of the surgery. He's going to come say hi to you and mark your arm. You will also meet with the anesthesia provider at that time. This is general anesthesia. You are not going to remember any of this. You will be completely asleep. They do use a nerve block where they numb up the arm. The reason we like this, they don't have to use the heavy gases and the heavy narcotics that really mess with your brain and make you feel sick. It is a weird feeling. It's like when your foot falls asleep. Your arm is completely numb. You can't really feel it. You can't really move it, but it is definitely worth it not to have the heavy gases associated with the anesthesia. Any questions regarding either the nerve block or the general anesthesia, you will be able to ask the anesthesia provider that morning. We will be giving you prescriptions prior to your surgery. Everybody will be given a pain medication prescription for 1 week's worth of narcotics as long as you do not have a pain management provider. If your primary care doctor or you have a pain management specialist who provides narcotic medications for you on a regular basis, they will be required to give you your medications after the surgery. If you are having surgery where you will be going home the same day, once we know for certain that you are going home, we will be giving you 3 additional prescriptions. One is for an antibiotic, usually doxycycline. This is taken twice a day, morning and night. I always recommend with food, although it's not required, for 1 week. You will be given an anti-inflammatory prescription called Toradol or Ketorolac. I want you to take this 1 pill as soon as you get home, 3 times a day for 3 days. It helps get you over the hump. The third medication, most people don't need. It's an anti-nausea medication called Zofran or ondansetron. We do send it home with you just in case the anesthesia upsets your stomach. However, we have given you this medication through the IV and most people do not need it. If you are having a joint replacement surgery where you are staying overnight in the hospital, all these medications are given to you in the hospital and therefore no further prescriptions will be handed to you. Sometimes after surgery you can get itchy anywhere on your whole body. It's just your body reacting to the stress of having surgery. If this happens, you can take over-the-counter Benadryl as directed on the box. This does not interfere with any of the medications. However, it is very dehydrating. You want to make sure you drink a lot of fluid if you're taking the Benadryl. It's common after surgery for your throat to feel sore or dry afterwards. This is usually from the anesthesia and the intubation. We recommend any lozenges, throat sprays, jello, pudding, non-sugary, ice cream, whatever makes you feel better. It is also common after surgery to get constipated between the pain medication and the anesthesia. We do recommend a stool softener or a laxative just until you have a normal bowel movement. Before you leave the hospital, our social workers are going to meet with you to help arrange a home health care agency. This will be a nurse that will come to your house to change your dressing. Usually this occurs every other day as long as the dressing is dry. However, if there is a little bit more oozing, they will come on a daily basis. They will send an occupational therapist to come to your house for a few visits to make sure that you are wearing your immobilizer correctly and that you are doing the pendulum exercises correctly. If the therapist that comes to your house demonstrates with you anything different than what's shown to you either in the office or at the hospital, please say no. I am not there. I am not saying that they are wrong, but I am also not there and saying they are right. So I'd rather you err on the side of conservatism and do what is requested from you based on this office rather than a therapist coming to your house. Also, an aide. Insurances allow an aide to come to your house 3 to 4 times a week for about 45 minutes to help you with the sponge bath. There are no real showers till the sutures come out. Once the sutures have been removed, you will be able to shower without assistance. Again, the social workers will arrange this home health care agency through your insurance prior to leaving the hospital. The home health care agency will be contacting you to schedule their appointments at your house because they are coming to your home, so be aware of those phone calls coming in. Now, following the surgery, bruising and swelling, very common, very normal. Because we operate on top, gravity pulls down, all that bruising and swelling can move down your arm to your hand, it can move into your chest. This is normal, nothing bad is happening. It can look pretty impressive. Please do not panic, it is normal. When you wake up from the surgery, you're gonna have an ice machine wrapped around the shoulder. We want you to ice this shoulder as much as you can for at least the first week. Everybody is different in terms of how long they can tolerate it, and there is no strict recommendation. The more you can ice the first week, the better it is for the swelling. You will also wake up in an immobilizer. Dependent on the type of joint replacement that you have, whether it's an anatomic shoulder replacement or a reverse shoulder replacement, would determine what type of immobilizer you are placed in. When you wake up from the surgery, you'll be wearing the immobilizer. You will be wearing the immobilizer for a total of 6 weeks. You wear this all the time. You come out of it to get dressed, you come out of it to bathe, you come out of it to do your pendulum exercises 3 times a day. The rest of the time you are wearing the immobilizer, including sleeping. You can sleep however you are most comfortable as long as you are in the immobilizer. Many patients recommend a reclining chair, saying they feel more comfortable, but there are patients that go straight to bed with a bunch of pillows around them, and there are other people that like the couch. Whatever works for you, as long as you are in this immobilizer, we are okay with. Again, please, no real showers till the sutures come out. We do worry about infection at this time. Before you leave the hospital, our therapists are going to meet with you. They are going to show you how to get in and out of the immobilizer, and how to get dressed, and how to bathe, and how to do the exercises we want you to do. While there will be a piece of paper demonstrating these exercises in the folder that will be given to you, again, they will go in much further detail at the hospital prior to you leaving. Now, Hibiclens. Hibiclens is a special antibacterial soap that's over the counter. It's a way you can help us fight infection. You can find it anywhere. It's over the counter. You can find it at CVS, Walgreens, Publix. It is recommended you shower the night before the surgery as well as the morning of the surgery. I do not need the whole body. What you do is you allow your upper extremity to get wet, and on the operative arm, we want soap from the base of the neck, down the arm, hands, fingers, with a lot of soap in the armpit area. You wait 5 minutes, and then you wash it off and pat it dry. In terms of antibiotics, we do give all of our patients antibiotics through the IV prior to the surgery. If you are staying overnight in the hospital, all the antibiotics will continue to be given to you through the IV after the surgery. If you are going home the same day, again, a prescription will be given to you where you will take an oral antibiotic for 1 week afterwards. Thank you for listening. If you have any questions or concerns, please don't hesitate to reach out to the office. We are always available either at the appointment where we will be seeing you prior to the surgery, or via email or telephone. Thank you.